Thank you all for joining us for our next telehealth health literacy session for this month. My name is Caroline Price. I'm your standing host, as well as the administrative officer with our Connected Care program, and I will let our speaker introduce herself today.
Hello, good afternoon. My name is Angel Peterson. I work in medical records as one of the assistants, and I also assist with vital records department.
Yeah, perfect. So we're going to go ahead and jump right in to our session today around medical and vital records. So jumping right in, what are vital records and why are they so important for public health?
Yes, vital records, they're basically official documents that record different things, such as life events like deaths, births, marriages, divorces, things like that. And it's very important because it helps to track like the trends that's going on within our small community here, and just record, more data, that's going on within Cumberland County.
So how would you say our health department here manages those vital records as far as registration goes?
Yes, ma'am. So our process is, what we do is we normally check our system. It's called NCDAV. That's our small database system. So we go through that system daily and check for different upcoming births or deaths that's been going on recently. And we review those for accuracy. And then we send those over to the state, and they'll do their system check and make sure everything's accurate. Also, they'll release those births, deaths, or any documents to the register of deeds for clients or offices to pick up.
Okay. So what steps would you say that someone would need to take to obtain a copy of their vital record, whether it's a birth record, a death record, or marriage certificate?
So if a client or if it's a birth certificate, the patient or the mother of the person that was born, they have to go to the register of deeds office to pick up a copy. So usually they're open Monday through Friday from 8 to 4, and the process is pretty simple. They go in and they're assigned their information packet to get it released, and then they'll get the copy of the certificate. Yes, ma'am.
So what about as far as our death certificates and marriage certificates the same pretty much, or those?
Yes, ma'am. It's the same process. It's just a different department within the courthouse here in Cumberland County.
Okay. So how would you say the availability of accurate vital records helps with planning and public health in general?
It really helps with just learning the trends within the community. With the vital records, we're constantly just watching things that happen over time. So lately we've been seeing a lot of homicides, within the Cumberland County. There's always something going on. So we use those vital records and the statistics, that goes on in the community to kind of just, put together what's been rapidly happening.
So I guess to kind of piggyback off of that, when you have your accurate vital records, what are, I guess, some of the newer things or newer things that you guys are working on to kind of help maintain those? As far as, so what are some of the newer maybe processes that you all have in place to kind of help maintain some of those records in general? So really, we really don't do much with the records, really. As far as the process, we do keep track of everything. We keep track of what's going on, our personal spreadsheet to kind of see what's just happening in our community. But most of the stuff that we really look at when it comes to vital record is just making sure that it's correct and then getting it to the right department. Gotcha. Okay. So what would you say are some of the common issues that people face when they're trying to access their records, and how would you say that those folks can resolve those?
The common issues that we have is when clients come in and want to get a copy of it, is them bringing the proper identification. So a lot of times patients will come in, they have expired IDs from 10 years ago, and they want a copy of their records, but we have to have something updated. And sometimes it's kind of hard to get it through to the patients because, they feel like it's their record and they need it, but we have to do, the proper protocol in order to receive those records. But that's really the main issue. But what we have been doing when they call to obtain those records is tell them up front, hey, you have to have your ID or you have to have some kind of social security card that matches, so that we can get your records processed, for you.
Gotcha. So do you guys require 2 forms of ID roughly?
Just one. Long as it's a real ID or any type of state issue ID and it matches what's in the system, we can give you a copy.
Okay. So how would you say the public health department works with other agencies to ensure that the vital records are accurate and their the integrity is maintained throughout that?
Really, it's really with just communication. We communicate a lot with different medical examiners, funeral homes, directors of funeral homes. So we just keep in contact to make sure that we're both crossing our I's, dotting our I's and crossing our T's, and making sure that everything is accurate. So basically just communication. That's the biggest role about working in vital records and medical records. And just communicating and make sure that each record is being, thoroughly checked, because it's a really important document.
And I'll ask this question as well. I'm kind of maintaining, or kind of coming off that. What do you guys do as far as make sure that HIPAA is not violated when you all are accessing these records?
We're verifying a lot, verifying everything. So sometimes we have patients that will call, and they're calling to request it for someone else. So we can't really go, but so far as in reaching to the actual, individual to make sure that, okay, we're getting permission, to give this record to this third party. So a lot of it is really just communicating with the actual patient, make sure you're verifying IDs, you're making sure everything matches in the charts. Just doing your thorough check and making sure everything is correct.
Perfect. So are there any new regulations or changes in how vital records are maintained here in our county?
No, we kind of have, the only change now is that we're not we're paperless now. Oh. So everything is with NCTV. So I guess, having paper records back then, it kind of made the process more harder, but it still got done. But now that we're paperless and everything is in NCTV. So.
Are you all finding that there's any pushback with that, or any setback, or are folks pretty much, is that more convenient for a lot of people?
It is. The only thing is with NCTV is trying to, if we have an issue with NCTV as far as working in the system, it's kind of hard to get someone like a live speaker with NCTV to, help us with any kind of technical issues. But other than that, it's a really smooth system. We can get the things done, within a couple seconds, a couple clicks, everything's released.
That's awesome. That's really cool. So how would you say that electronic vital records again, improve that accessibility as far as reducing the errors per se? Are you all finding that there's less errors that are made?
Right.
Electronics, is that kind of what you guys have gotten to at this point?
Yes. Gotcha.
Deal. So what role would you say that data privacy plays in the management of those records? Well,
the good thing about, just what we said earlier about HIPAA is very important, especially when it comes to vital records. So really, the good thing about it, as far as the role, is that no one can access NCTV but just, personnel. So if you're an employee and you have to work with NCTV, you're the only one that can get NCTV. So it makes it more, private and confidential, and you won't have to worry about no one getting any kind of information for patients without their permission.
That's important, I guess, that security is there.
Yes.
That's not breached at all.
Yes.
So, just hypothetically speaking, can vital records be used for any research purposes? And if so, under what conditions can those be?
Yes, and again, also for research purposes, as long as it's healthcare personnel, that can get access to that. But it could be used to help, with the trends out here, and we can see what's really going on in our community and figuring out, things that we can stop or things that we can prevent, like illnesses or just any kind of hazards in the community. So it really helps with just monitoring those trends to see what's going on.
Perfect. Well, thank you all for joining us again today for our session around vital medical records. Thank you, Angel, for being here with us today as well. Again, you all can access our session on YouTube as well as on Cumberland County NCTV. So thank you all again for joining us, and I will see you back here again next month.